introduce our panelists today and give a little more perspective on their expertise and why we have selected them to be here today. So sitting to my immediate left is Dr. Dean Aubin. He's a board-certified emergency physician with more than 15 years of experience in a variety of high-demand settings, including high-level trauma centers, military hospitals. He received his degree from Texas Tech University, and he currently practices in Texas. Sitting next to Dr. Aubin is Dr. Dara Tash. Dr. Dara is a bit more local. He's based in Maryland. He was born and raised in Iran, and his own father actually studied in the United States. And his father was a professor of medicine at prestigious Tehran University, and that inspired Dr. Tash to go into medicine. He has been affiliated with a range of institutions, but he currently holds the position of the head of ophthalmology at the Frederick Health System. His subspecialty is in vitreoretinal surgery, focusing specifically on ocular trauma. So that relates to why we've asked him to be here today. He's here today on behalf of Too Much Suddenly Foundation, which is a nonprofit registered in Maryland that seeks to promote unifying education within the Iranian diaspora. Azadeh Afshahi really needs no introduction, but she was born in Iran at the age of 8. She moved to Sweden with her family, and in 2004 she relocated to California. Her work with the survivors of the Las Vegas mass shooting was featured in 2017 in Modern Healthcare, and she has traveled to India, Tibet, and Liberia to personally volunteer her time and her services to help people who have been afflicted by any kind of mental trauma. Since her experience ranges from inpatient psychiatric hospitals to private practice. So we are very grateful to have Azadeh's expertise here today. And last but not least is Dr. Kimia Aubin. Dr. Aubin is also from Texas and currently practices in private practice there. She's also a graduate of Texas Tech University. Her specialization is in radiology. And today she's going to be shedding light on the unique aspects of that field and its relevance to human rights. So I would like to go ahead and turn over to Dr. Aubin here, who will lead us off. Thank you.
Good morning, and again, thanks everybody for being here to listen to a different perspective that sheds light on what's been going on and the difficult events continuing in Iran. My name is Dean Aubin. I'm an emergency physician, and my profession often elicits a particular response when I tell people what I do for a living. And it's usually, I wouldn't want your job. And I can empathize with these reactions because my role frequently exposes me to the darkest side of human experience, where I encounter the very worst that human beings can do to one another. People turn to me when they've been subjected to neglect, abuse, all types of violence, or simply find themselves in dire need with no one else to turn to. For the past 16 years, my career journey has taken me from where I literally began in the aftermath of Hurricane Katrina in southern Louisiana to massive level of trauma centers, military hospitals, as she said, and tiny rural facilities that have hardly any resources at all. And in these diverse settings, I've encountered many challenging situations, and I've seen a great deal of human suffering. These experiences unfortunately made me essentially an expert in dealing in human tragedy and hardship, which is what brings me here in front of you all today. As an emergency physician, one common question that I'm asked is, what's the worst thing that you've ever seen? And usually this is in a casual setting, so I offer a milder anecdote to spare the person that asked me the question from the reality. However, today I'm here to provide a more unvarnished truth. One of the most distressing things that I've witnessed transcends any single clinical patient encounter, and that's the exploitation of healthcare as a weapon against citizens, as is happening currently in Iran. For example, I've seen disturbing reports, photographs, and videos that reveal how the Iranian government security forces have been using ambulances complete with lights flashing, not for the purpose of providing medical aid, but as a tool to infiltrate protests, detain these demonstrators. These ambulances, instead of carrying life-saving equipment and paramedics, they transport armed security personnel that forcibly apprehend these individuals, load them in the back of an ambulance, and take them to prison. This despicable act not only violates the fundamental principle of do no harm, but it's also instilling a deep fear of ambulances among citizens on par with police and security vehicles, thus impeding their access to essential medical services. And rebuilding that trust is possibly going to take generations of work. To make matters worse, the stark reality is that even reaching a hospital, a place traditionally associated with refuge and healing, no longer assures relief for countless sick and injured Iranians. Upon arriving to a hospital, their identities are meticulously recorded by intelligence agents, Revolutionary Guard. Depending on the severity of those injuries, some are immediately apprehended at the hospital. Shockingly, there have been instances where these detainees, despite having just undergone surgery, were very abruptly discharged and then subsequently arrested. And as she said, I personally analyzed photographs of these surgical patients, and in my professional assessment, it indicates a likely premature discharge from the hospital. Now that obviously increases the risk of infection, of complications, and potentially life-threatening consequences due to this incomplete treatment. Given the government's actions, many wounded protesters understandably live in fear of seeking hospital treatment and have no choice but to manage those injuries at home, all in a desperate attempt to avoid arrest. So out of this government-instilled fear and their reluctance to leave their homes, many patients have resorted to online medical evaluations. Now, as you can imagine, trying to evaluate a serious condition through a dimly lit Zoom call or even more problematically, text and Facebook messages, introduces obvious grave risks. Remote assessments inherently lack the vital physical examination and that hands-on interaction that's essential for a precise diagnosis, which can lead to a misdiagnosis and delayed treatment, obviously. This challenge is even further worsened by what we all experience with technical glitches, connectivity issues, which is going to also delay follow-up care to make sure that these patients are recovering or doing well. Another, albeit far from ideal, option that has emerged is an underground network of medical providers providing care out of their very own homes. As doctors and nurses have been compelled to operate in these secret, poorly supplied settings, they face countless challenges. It's impossible to maintain the same level of cleanliness and uphold the sterile techniques that one would see in a hospital, and this is dramatically also going to increase that risk of infections and complications during and after their medical procedures. Obviously, the lack of these medical equipment and facilities severely compromises the safety and effectiveness of those treatments. And additionally, the covert nature of the entire operation that these doctors and nurses are doing adds another layer of risk to these patients, and many withhold important aspects of their medical history, just all in an effort to not be arrested or alert any authorities, and makes the planning and the treatment all that much more difficult. The medical profession is rooted in unshakable pillars of impartiality and compassion, with our core duty being to care for the sick and wounded, free from the taint of political exploitation. Using it as a weapon is simply disgusting to me. I hope you'd agree with me that it is one of the worst medical stories that you've heard, and you're eager to help us all end it. And I thank you all for your consideration.
Wow, thank you so much. That was so impactful. I want to take this opportunity, given your emergency medicine expertise, to ask about someone who is on the minds of a lot of us here, which is a girl named Aubin. She is a girl who just very recently was allegedly assaulted in the metro, and she collapsed there within minutes of the alleged assault. She was just officially confirmed brain dead, I believe within the last 24 hours. Finally, Iranian state media conceded that she was brain dead. Her case has gotten a lot of attention because the Iranian regime stated that she collapsed due to low blood pressure. And so I would like to ask in your opinion, what is the likelihood that someone of about the age of 16 of average health could sustain that kind of a traumatic head injury from a collapse at standing height? If you could elaborate on that further, please.
Sure. When I read that, as a layperson, it's almost laughable, because the first thought I had was, how did they know what blood pressure was on the subway train? So, but then objectively as a physician, that it brings me back to, I think of everything almost in terms of ER regarding trauma. And head trauma is something that is extensively researched in emergency medicine, because, again, one of our major missions is to do no harm. And the easiest thing in the emergency department would be everyone who got hit in the head or fell and hit their head to CAT scan everyone. And that is not only expensive, but it's radiation, and we don't want to have unnecessary radiation to anyone. So we do a lot of studies and extensive research on this particular subject. And there is one particular study out of 2003 that everyone uses because it was so accurate in head trauma prediction as outcomes. And essentially they researched a lot of people who had had head trauma and what the outcome was if they had significant injuries in the brain. And they were surprised, the researchers, because they were studying tens and tens of thousands of people. And it was so rare that they had to increase the size of this study sample up to 48,000 people. And I believe they only detected 608 actual traumatic injuries in the brain. Just to give you numbers, it's exceedingly rare to fall or have head trauma and have a significant injury that would ultimately kill you. And just for another example, one of the criteria that we look at when we have someone with head trauma is fall from a standing position, is, unless you have other major medical problems, is pretty negligible. And in this study, they had people falling from a height of 3 feet, and that wasn't even enough. If you fall from your 3 foot, these tables are maybe 2 foot, and strike your head, the likelihood is so low. And so it had to be a 5 foot fall. So you can imagine, barely over 5 foot, but that's it's quite a significant fall with quite a significant injury. So the likelihood of that is so low, it's almost negligible, definitely less than 0.5% chance of that. So.
Thank you so much. I would like to pass it over next to Dr. Dara Tash, who is going to address the issue of shooting in the eye that began during the crackdown last fall.
Good morning. My name is Dara Tash, and I am representing the Tomaj Saleh Foundation, a non-profit organization dedicated to promoting democratic education within the Iranian diaspora. Today, I would like to provide an ophthalmologist's perspective on the dire situation concerning eye injuries sustained during protests in Iran, as highlighted in the recent report by Dr. Afshahi from the American Academy of Ophthalmology. Ophthalmic surgeons in Iran have taken a commendable step by organizing a petition to address the issues of eye injury inflicted upon protesters. The petition, which has already garnered 150 signatures, calls upon the police to cease targeting individuals' faces and heads during the protests. The motivation behind this plea stems from the understanding that ocular trauma can lead to devastating injuries and permanent blindness. While many of these protests have been peaceful expressions, others have witnessed brutality from armed authorities, resulting in numerous injuries and an estimated death toll in hundreds. The exact number of traumatic eye injuries sustained by protesters remains challenging to ascertain, primarily due to some injured individuals evading arrest. However, Iranian ophthalmologists have reported a surge in cases of ocular trauma, including ruptured globes, severed optic nerves, damaged retinas. As of September 2023, the Iran Human Rights Organization, IHR, a Norwegian entity, has documented 138 cases of eye injuries during the protests. In November 2022, the New York Times reported this number to be as high as over 500 based on data from 3 major eye hospitals in Tehran alone. Much of this irreparable harm can be attributed to the use of rubber bullets, which are often directed at the eyes instead of lower body or the ground. Law enforcement has also employed weapons like paintballs for facial identification marking and hollow point metal bullets that expand upon impact, causing severe damage to orbital structures and lodging in soft tissues. Orbital CT scans showing numerous metal pellets lodged behind and around the eye have also been reported. The extent of ocular injuries in Iran remains shrouded in obscurity, given challenges related to communication, government threats, censorship, and internet shutdowns. Much of the information comes through secure network messages from ophthalmic surgeons in Iran, who exercise caution when speaking out due to fears of becoming political targets. American Academy of Ophthalmology reports that Iranian ophthalmologists have also been contacted by individuals seeking advice on managing their eye injuries. Many of the injured are reluctant to seek treatment in hospitals where they risk arrest. Even those who manage to access private treatment for eye injuries may face immediate detention post-surgery. The New York Times reported that medical facilities in smaller cities are struggling to cope with the volume of ocular trauma cases, and some patients have resorted to fleeing the country for survival. In the context of these distressing eye injuries, I would like to shed light on the alarming condition known as sympathetic ophthalmia. Sympathetic ophthalmia is a potentially devastating condition that can occur as a result of severe eye injury, particularly those caused by firearms. It is characterized by inflammation in the uninjured eye, following trauma to the other eye. Simply put, even the healthy, uninjured eye can go blind, leading to total blindness. This condition underscores the critical importance of immediate and thorough treatment after any eye injury involving guns. Therefore, the Too Saleh Foundation calls upon the Congress and the U.S. government to support humanitarian efforts by expanding the availability of visa waiver programs, as well as B2 visas for medical treatment, particularly at U.S. embassies in Middle East region on an urgent basis. Additionally, we request relevant OFAC exceptions to facilitate legitimate nonprofits like Too Saleh Foundation and other NGOs in aiding the medical victims of this conflict. I would like to remind our dear friends who have graciously joined us here today that without the support of France and Dutch Republic, the American experiment in democracy might not have succeeded. We now kindly request your humanitarian assistance during our time of need. I thank you for your attention and consideration. I'll stay around for any questions.
Thank you so much. I want to follow up on something you mentioned, which is you pointed out delays in care. The people who are able to escape or flee Iran, very often they're ending up in Turkey. Can you elaborate a little bit on the types of, how that would impact your prognosis, or how that would impact an eye injury to have, let's say, a delay in care to the tune of maybe several weeks as a person needs to flee, and how that would impact recovery?
Generally speaking, the injured eye most likely will go blind. If the individual is lucky during the several weeks it takes to get to Turkey, they might face an infection that may become systemic and life-threatening. Once again, if they survive the second step, this issue of sympathetic ophthalmia may take their other eye. Even if they get the appropriate treatment, once it gets going, it's really hard to stop it. And that individual goes totally blind. And usually at an early life, and it's very difficult to recover from this psychologically.
So I want to have, if I may ask for your professional opinion on intentionality here, because the Islamic regime could say, well, these were, the things that they will allege. These were protesters, and the shooting in the eye is accidental. It wasn't intentional targeting. But can you speak a little bit to the uniqueness of the eye in terms of the fact that, we never hear about eye transplants. We never hear about, the ability to replicate any kind of, using prosthetics or things like that. And I would love to know what you think about whether and how it reflects intention on the part of the Iranian regime to have these types of injuries in this part of the body.
So it's really hard to do a statistical analysis and compare the injuries. You need to know the number of eye injuries, total number of eye injuries, and total number of protesters who were injured, and do statistical analysis on that and compare it to other countries where they've done this. Nevertheless, the numbers that are being reported is so extremely high that, in my opinion, there's no doubt that it's intentional. Certainly it's intentional to shoot the paintballs at the face because they want to identify those individuals by the marking on the face. And there is a point of comparison. Last year there were lots of protests in Colombia, and Amnesty International had documented a total of 50 cases in very massive protests where with the 50 cases they say this is definitely intentional. We have probably minimum of 138 totally very well documented cases, and maybe upwards of 500, 600, maybe up to 1,000 people who've been blind.
Can I make a note of kind of on the heels of that is that one of the physicians in Iran, Dr. Rostami, was a 36-year-old physician from Tehran who was spearheading the treatment of citizens who were afraid to receive care in hospitals for the reasons that Dee mentioned, for fear of being targeted and abducted and taken to jail or by the regime. Dr. Rostami was one of the physicians who was part of the network taking care of civilians in their own homes. She was targeted, abducted, physically, sexually tortured, and a part of that torture that she faced was enucleation or removal of her eye before they murdered her. And so that just, it's their MO, it's their modus operandi and one of their signature characteristic forms of torture.
Yeah, thank you. Thank you for spelling it out in that way. So next is going to be Azadeh Afshahi. By virtue of the nature of the fact that Azadeh deals directly with former Iranian political prisoners, the nature of her contents are a bit more distressing, so we just wanted to observe that. Thank you, Azadeh. Please go ahead.
Thank you everybody, and thank you for my fellow panelists. It's an honor to be here. Can you please hear me?
Yeah.
Okay. So my name is Azadeh Afshahi, and since the start of the Mahsa Jinnah revolution, I've been providing mental health services to individuals who've been detained, arrested, or imprisoned due to their political beliefs, affiliation, or actions via applications such as WhatsApp, Telegram, and Google Meet. By far, the lowest and most challenging and painful experience of my professional career was when an Iranian refugee residing in Turkey publicly tweeted his suicide note. Upon contact and after spending 6 hours on the phone with him, he decided to end his life. He died by ingesting a cyanide pill. I can still hear his last breath as I was trying to convince him to accept help. I still wonder if I could have done or said something different. The logical left side of my brain says, you didn't have the resources available to you. He was in Turkey with limited mental health access. However, the right side of my brain cannot help to ask, what if? You see, Mehdi is one of the many innocent people who are the victims of the brutal treatment of the Islamic Republic. Since September 2022, 697 innocent people have been executed by the Islamic regime. Over 23,000 people have been arrested. 638 have been killed, which 70 of them were minors. I've been working closely with prisoners and recently visited Turkey to meet with some of them in person. Based on what I've seen and heard, I believe with high probability that the 23,000 arrested have endured some form of torture. Unfortunately, the psychological devastation experienced by one political prison often echoes through the family, causing great mental strain of family members. Iranian political prisoners are subjected to various forms of physical, emotional, and psychological abuse, including torture, isolation, rape, and deprivation of basic rights and freedom. The conditions that they face are harsh, including inadequate food, water, as well as being detained, denied access to medical care, legal representation, and family support. From all my research and direct relationship, these horrific conditions are standards, not outliers. As you can imagine, the uncertainty and fear of not knowing when and if will they be released or executed have a profound impact on their mental health. The symptoms that I've been treating for the past 14 months include PTSD, general anxiety, depression, thoughts of death, suicidal ideation or suicide attempt, sexual dysfunction, particularly for those who have been experiencing sexual torture or rape, substance abuse, and some somatic disturbance, such as pain, headaches, or other physical complaints. You know, one possible reason why psychological torture is related to bodily discomfort is the fact that conditions of captivity prevent any emotional expression, including expression of feelings. In my professional experience with this community of victims, the intensity of their psychological symptoms is directly related to the amount of exposure to physical and electrical torture and psychological ill treatment they have endured. The most common form of torture, here we go, mock execution, blows to the head which can cause internal bleeding in cases of Mahsa Jina Amini and Armita Garavan result in death or brain death. Repeated blunts to the feet, usually applied with a baton or similar object, making it painful and difficult to walk. Electric shock between the toes or the tongue, penis, anus, and vagina. The chicken kebab, in which the wrists of the victims are tied behind the back and the victim is suspended by the wrist, leading to severe pain, frozen shoulder, and loss of consciousness in a short period. Sexual abuse, including the introduction of foreign bodies into the vagina or rectum, and other forced sexual acts and witnessing of sexual abuse. Rape, which can be violent, bloody, and physically traumatic for victims. Even worse, gang rapes are performed by IRGC guards. This is often characteristic by extreme violence and trauma. Two horrendous examples of this includes a 15-year-old Kurdish boy and a female patient who endured this for 10 days in a safe house. For example, this female resulted in pregnancy and sexually transmitted disease. Long periods of solitary confinement. Tumor Salehi was subjected to this for 252 days. And Jamshid Sharman endured this for more than 1,000 days. And according to the United Nations, more than 15 consecutive days of solitary confinement is considered torture. Most torture victims have described the environment inside the prison as being packed, filthy, overcrowded cells without access to fresh air, sunlight, and ventilation. Factors that must be noted: health problems during detention, harassment during arrest and after release by the regime, and family, marriage, and economical difficulties. These are all realities that victim of the Islamic Republic faces. Services that needed once the victims are released include medical care, counseling, monetary assistance, rehabilitation, and reintegration into society. Unfortunately, not one person I have helped so far have had access to these critical services. One often overlooked aspect of psychological recovery is reparative justice, or what we call closure, the opportunity for a victim to document and criminalize the trauma they wrongfully endured. Unfortunately, the people of Iran do not have the option to seek justice, as it may result in execution. Because victims of the Islamic Republic are not able to seek justice, I believe it's important that medical professionals, particularly mental health experts, use the privileges and freedom they have as a platform to advocate on behalf of innocent, oppressed people like the ordinary citizen of Iran. I cannot pass judgment on Mehdi for wanting to bring end to his suffering, or for seeking suicide as his only option. Unfortunately, I have never had a chance to know Mehdi deeply, to know the demons he was battling. But if he experienced any of the aforementioned tortures, we have collectively failed him and people like him. I would like to urge U.S. medical health providers to play a more active and supporting role within global efforts to end gender apartheid, obtain justice for the violation of human rights done by the Islamic Republic of Iran. I would also like to encourage the United States government to increase political asylum availability for verified Iranian victims, similar to the program's expansion for Ukraine asylum seekers following the invasion of Ukraine by Russia. The victims' circumstances create a cycle of poverty and isolation, inflicting severe and lasting damage on individuals and communities. Efforts must continue to expose and combat this practice, including advocating for legal protection, psychological support, and social awareness to well-being and dignity of political prisoners. This includes by supporting calls for democracy from within Iran, supporting the campaign to end gender apartheid, and providing increased funding to educational advocacy nonprofits and NGOs. I call upon the medical community to continue to collaborate on important educational initiatives to raise awareness for the statute of Iranian political prisoners. As I said earlier, I still wonder if I could have done something different for Mehdi. I will never know the answer to that question. However, we all have the power to honor Mehdi's legacy by protecting his tortured countrymen from similar tragic ending. Thank you for listening.
Thank you, Azadeh. I know it takes a lot out of you to also relay this information, and I just want to emphasize how valuable and important it is that you do share and you do provide the details to
to be factual, to be accurate, to paint the true picture of reality. So thank you for that. In another setting, I had heard you describe the released prisoners as, you said that they felt like they were forgotten people or lost people. Can you describe or paint the picture of what their experience is like after they come out of prison and how difficult that was?
Sure. First of all, thank you for sitting through that. I'm sure it's not easy to listen. They're like, when I went to Turkey and I experienced firsthand, as any medical profession, you want to have that connection with your patient or who you're treating. So to me, it was a privilege to be able to travel to Turkey, to sit down with them and see for myself what they're going through. And one important part of healing is that justice part, to see what's happening, whether or not they are ever going to get to the point that they're going to see what's going to happen to the regime. And it is extremely difficult for healing to occur when that aspect of justice is excluded from the equation. So it is, that's what I witnessed, and that's emphasizing the feeling of that they're forgotten because of the fact that they are now in Turkey. If they have the privilege or resources to escape Iran, they're now stuck in Turkey, such as Mehdi. Mehdi was there for 6 years. And this is nothing. I have patients who's been there for 12 years, 9 years, and we really need to find a way for them to be able to come to United States or Europe for them to continue the treatment and start the healing process.
Thank you so much. Okay. Last but absolutely not least, Dr. Aubin, please share with us your perspective as a radiologist.
Good morning. I'm Dr. Kimia Aubin. I'm a first-generation Iranian American from Texas. My specialization lies in radiology, and that's the medical field dedicated to utilizing imaging techniques for diagnosing and treating diseases, particularly useful when it comes to diagnosing signs of trauma or detecting signs of trauma. I'm here basically to offer a radiologist's perspective on the crucial role that my specialty plays in ongoing future fact-finding missions, specifically concerning the documentation of verifiable human rights violations by the Islamic regime in Iran. I firmly believe that radiology has a significant part to play in documenting and preserving evidence of Islamic regime's crimes against humanity. Amidst the backdrop of the Women Life Freedom Revolution in Iran over the past 13 months, the global community has borne witness to widespread government-sanctioned human rights violations against civilians, including children. Shockingly, in 2022 alone, 582 people were executed in Iran, second only to China, and over 23,000 individuals, most of them under the age of 30, were incarcerated. The physical and sexual torture of Iranian political protesters, a substantial portion of whom are children, detained by the Islamic regime forces, occurs not only on the streets, but also within detention vehicles, such as Dean mentioned, the ambulances mentioned earlier. And this torture continues even in medical facilities. Gathering medical proof of physical torture is often an intricate task, especially when torture methods employed minimize signs externally, and particularly when medical attention is often delayed or denied. Many forms of physical torture result in bone damage, which can, to some extent, be detected by standard x-rays, the primary diagnostic tool for the detection of skeletal trauma. Radiographic signs are many. I can provide an exhaustive list, but characteristic forms of injury, such as depressed skull fractures, which is frequently a result of a direct blow, commonly seen in the skull. Skeletal fractures, multiple fractures of various healing stages, particularly in fingers, which is a common form characteristic of torture performed by the Islamic regime. However, X-rays sometimes fail to reveal injuries such as occult fractures and incomplete damage. CT scans can also be used both in living and deceased victims to detect damage to bones and soft tissue. Even signs of forced organ harvesting, which we've seen happen at the hands of the Islamic regime in Iran. Bone scintigraphy is a method that we employ and can reveal trauma even several years after the event, which is important because otherwise it could be very challenging to find any physical or radiological evidence. In March 2013, Forensic Science International published a study showing that bone scintigraphy can be a valuable tool for assessing and corroborating alleged torture, even many years after the event occurred. Human rights organizations like Human Rights Foundation in Turkey have shown a significant correlation between trauma and focal bone lesions, such that this documentation can later serve as valid evidence in court and international monitoring efforts. The Islamic regime systematically targets protesters seeking care in hospitals, leading to many victims of abuse delaying or avoiding medical care altogether, resulting in a lack of imaging in acute settings. This is where the ability of radiology to detect trauma even years after the occurrence becomes increasingly relevant when documenting the Islamic regime's crimes against humanity. Radiologic documentation of torture allows assessment in several circumstances, including corroboration of experienced or reported trauma when the patients or the victims are conscious and aware of what happened to them. Trauma sustained while the victim was temporarily unconscious. Perhaps they passed out while they were being tortured, or maybe they were drugged and are unaware exactly the extent of what happened to them. Or trauma in currently unconscious or even deceased exhumed victims. And in diagnosing forced organ harvesting. Under these settings, we've had torture victims that may be detained for prolonged periods of time, during which external signs of torture and trauma, if they ever even existed, have disappeared. We have example of 53-year-old medical doctor Hamid Hassan, who's still in custody, who was subjected to torture to extract a forced confession. X-ray images seen by BBC corroborated that Dr. Hassan had sustained fresh rib fractures piercing his lung while he was in custody of the Islamic regime. Radiologic imaging aids in evaluating those victims that I mentioned that perhaps were either drugged and unaware of the extent of injury or torture that they were subjected to at the hands of the Islamic regime. As far as the evaluating patients who are either currently unconscious or deceased, we have victims that are unable to recount what even happened to them, like in the case of healthy 16-year-old Armida Garaband, who was beaten by morality police on the subway for not wearing her head covering, but then she was declared brain dead after weeks of being unconscious in the ICU. Well, radiology can help determine, at least to some extent, by the characteristic forms of injury, like the skull pattern, what kind of skull fracture, brain trauma. The imaging gives us information that she cannot convey. And I'd like to note forced organ harvesting. It's important to note that victims with external signs of organ theft are often deceased. We have cases in Iran like that of 16-year-old protester Elika Eftekhari, who was abducted by the regime, later buried. When she was exhumed, her body showed external markings consistent with physical and sexual torture and organ theft. We also have a similar case of Hamid Salashur of Izeh, who was abducted, tortured, and buried by the regime. His body revealed signs of severe head injuries and surgery upon exhumation. His family mentioned that he had stitching, or sutures, basically from his neck down to his navel and over his kidneys, suggesting forced organ harvesting. Radiology will undoubtedly play a pivotal role in supporting fact-finding missions dedicated to documenting these heinous crimes against humanity perpetrated by the Islamic regime. However, it's crucial to emphasize that the global community must also actively advocate for and facilitate unrestricted and free access to the internet within Iran. This open access is essential for enabling fact-finding missions and the comprehensive documentation of human rights violations. Therefore, it becomes imperative for the international community, especially democratic nations, to extend their unwavering support in ensuring that all Iranians can access the internet without censorship or barriers imposed by the oppressive Islamic regime. By promoting unrestricted access to information and communication, the global community can empower individuals in Iran to connect with the world and share their stories and expose atrocities being committed against them. This collective effort serves as a vital step towards justice, accountability, and the protection of human rights in Iran.
Thank you so much. About the forced organ harvesting issue, in 2021, there was legislation introduced in Congress by Congressman Chris Smith called the Stop Forced Organ Harvesting Act. And unfortunately, it died in committee. And I would love to know, given that you have both a medical background, but you're also an active local grassroots activist, how do you believe, and if so, how, can the medical community play a role in terms of advancing the needle on legislative efforts?
Well, I think it's important that the medical community has the fund of knowledge and can bridge the gap between the Iranian diaspora, which knows what's going on and what's happening and has that information, but can bridge the gap between the Iranian diaspora and legislators, which have the power to make policies that support human rights. And globally, it's not just an Iran issue when it comes to that kind of forced organ harvesting happens globally. And so when medical professionals can step forward, we can all work together as in a collaborative effort and make these steps forward towards policies that support human rights.
Thank you very much. We are just running out of time, so I want to first thank all of our panel participants today for your insightful and informed commentary, Azadeh for her beautiful and moving opening remarks, and the nonprofit organizations that collaborated to make this panel possible: Iran Democracy Council, Progressives for Iranian Democracy, and Tumor Sadeghi Foundation. The Iranian American community is deeply appreciative of the opportunity to raise awareness about women life freedom from the nation's capital. We look forward to bringing future programs like this to raise awareness, whether it's expert medical doctors or tech experts from every industry. And the ultimate goal here is to support and amplify the organic calls for democracy and human rights coming from Iran. In the name of Masa Jina Amini. Thank you all very much.